Good afternoon, everybody. I show 4 o'clock. I'd like to call this meeting of the McLean County Board's Health Committee to order. See Member O'Neill, Member Farley, Member Bell, and Member Hanson there. We are missing members Bloomfield and Tompkins. Do we have any appearances by members of the public?
We have had no requests for members of the public or employees to speak tonight.
All right, thank you very much. Moving on to the consent agenda. Can I have a motion to put the consent agenda on the table? Excellent. Member Hanson, second by Member Bell. We show a approval of minutes from the December 5th, 2024 regular meeting and recommendation of approval of bills and transfers totaling $793,189.33. Any questions or comments? Let's take a vote. Those in favor?
Aye.
Those opposed? Motion passes. Moving on to departmental matters, we start with Ms. Lana Strum from Advanced Correctional Health Care. I show no items for action. Do you have anything to add?
Diane Hughes, I'm the superintendent, and
Oh, thanks, Diane.
no, we
Sorry.
have no items for action, but Ms. Strum is here if you have any questions about the report.
All right. I did have one question, actually. I noticed in your report an uptick with provider visits and counselor sessions in the month of November. Do you feel like those are more planned or scheduled events, or are they more kind of as needed, acute, like I'm in crisis and I need to talk to somebody right now kind of thing?
All the appointments are scheduled, but we do see an increase in the mental health needs.
Do you feel like inmates are aware of mental health resources to them
Yes.
and able to take advantage of
Yes.
it, and that's thoroughly used to its potential, then you feel?
Well, and the difference as well is now that our provider is on site, we're prior to this provider for the mental health stuff, our psychiatric provider was not on site, so she's on site usually 3 times a week. So.
Excellent, excellent. All right, thank you very much. Moving on to the health department, Administrator Jessica McKnight is here. We have 3 items for action. Like to combine those actions if we could. Can I have a motion to put those on the table, please? Motion by Bell, second by Hanson, please. Questions, comments?
Just from me, these are for some new grants that we received in 2024. So just adding the revenues and expenses to our budget since they were unplanned when we did the budget for 2024.
Gotcha, thank you.
Could you please read out the names of the 3 grants since we're combining these as one single action item?
Sure. So the first grant for Fund 105 is our Lifestyle Coach grant, and that's for diabetes prevention and management. And then our second grant, which is under Fund 107, is the tick surveillance grant, which is part of the Illinois Department of Public Health Comprehensive Health Protection Grant. And then the third one, also under Fund 107, is the Local Health Department Respiratory Surveillance and Outbreak Response Grant.
Okay, thank you. Questions, comments? All right, let's take it to a vote. Those in favor of approving 4B1A, 4B1B, 4B1C, please signify by saying aye.
Aye.
Those opposed? Motion passes. Thank you very much. Anything else to add, Director McKnight?
Not under the action items. You do also have my report. So 2024, this is a summary of achievements and highlights for the last year, also some of the goals that we have for 2025, and also some things we have planned. Highlighting this year that the Narcan distribution was something new, and we got our wall dispenser mounted. And so far in 2024, so that's the wall mount and also through trainings, we distributed over 1,000 boxes of Narcan from the health department. And also highlighting this year expansions that were in the action item of some grant work. So these new grants that we're receiving are allowing us to do more work. So with our tobacco, we're going to expand from just prevention to also now helping with cessation. The diabetes helping prevention previously. Now we're going to be doing some management also. So for those who do have diabetes. And then the tick surveillance. So expanding, we were working and still will be working with mosquitoes and West Nile virus surveillance. And so now we're going to move on to expand to tick surveillance as well.
Excellent. Thank you very much. All right. Moving on to 4C, Mr. Wiley from the nursing home. We have one item for action today, request approval of engagement agreement with Templin Healthcare Accounting Services. Can I have a motion, please? Member Farley, second by Member Hanson. Mr. Wiley.
Hello. This engagement letter is just to add to the services that he's already been providing us, the production of our Medicare and Medicaid annual cost reports.
Questions or comments? Take it to a vote. Those in favor? Aye. Those opposed? Motion passes. Thank you very much. Mr. Wiley, anything else to add?
We had another good month in November. Just to prepare everyone, December's census numbers will be a little bit lower because we've been making some adjustments in preparation for the construction project that begins February 3rd. So when we convene for next month's meeting, I may look a little grayer, but we'll be fine. By the way, the team is doing an awesome job preparing for this upcoming project. But we were grateful for some of the numbers that we were able to see in November. We saw another 10% decrease in our agency utilization, and revenue was up. Expenses were up, but as you'll see in my report, that was largely due to the fact that the month of November had 3 payrolls in the month, and that always has a significant impact.
Okay, thank you very much. Construction and everything appears to be on track and going to start on time then, as far as you're aware?
It's scheduled to start February 3rd, and we're anticipating that start date and already moving everybody off of the 200 wing, as that's where it will begin. And we've already made adjustments to staffing. I do want to say that our plan is that there would be no workforce reduction in that time frame. We want to take care of our employees, and we feel that with sound management of our census and of our reimbursement, we should be able to get through this project even with lower census, with a budget neutral outcome, or hopefully a budget friendly outcome.
Excellent. Wow. Excellent. Keep up the good work. Very cool. Very cool. All right. Well, thank you very much. Moving on to 4D, Mr. Tab from JDC. I do not see any items for action. Mr. Tab, anything to add?
No, I do not have any action items. You do have my report. If you have any questions, I'd be happy to answer them.
All right. Thank you very much. And lastly, moving on to Administrator Taylor. Administrator Taylor, anything for the good of the order?
Thank you, Chair Byrne. I do not have anything to present for action, but I do have something for information. The Executive Committee will be entertaining an action item related to the nursing home construction project. This was part of the overall bid project, but there is a need to remove some asbestos that is around the existing water tank, or the water heater tank. And so in pages 34 through 8, you'll see there the proposal, but that will be presented, like I said, through the Executive Committee because it is utilizing ARPA funds.
Gotcha. Is this water heater in the same, you mentioned the 200 wing, is this in the same area?
No, it's in the mechanical area of the building, and so this is just getting prepared for the upcoming project.
Gotcha. Okay, thank you. Any other questions, comments? All right, thank you very much. I show our next meeting date is February 4th, 2025 at 4 o'clock. Thank you all for your service to the county. Enjoy the rest of your January. We are adjourned.
Thank you.